for patients and their families.
A little bit. Where are you feeling that?
In my stomach.
In your stomach?
At UMC, healthcare is about more than medicine and procedures.
So let's not talk about the treatment part anymore. I just want to find out how you are.
UMC's palliative care and integrative services takes our treatment pathway to a new level.
We're not just going in, just pushing some meds and leaving the room. We're with the family, we're bonding. You find out the whole, for me it's holistic nursing because I'm a holistic nurse as part of the Tranquility program too. So I like to think of the whole family. So when you go in and you're working with the family and finding out what was that person like, what were their goals, what did they want, what was important to them, who's their family members, who's at the bedside with them.
It guides the family basically with the end of life choices. I mean, a lot of family doesn't know where to go. Most patients come in, doesn't have advanced care planning, doesn't have a living will, and they just listen to maybe one physician or a couple of the residents. Having Dr. Estrada and their team come over here, pretty much explain what's palliative care, what's hospice. It's really needed. I mean, I'm glad that we have it here at UMC.
Patients with life-threatening injuries or life-limiting illnesses such as cancer, dementia, cardiology, or stroke issues that come along with burdensome symptoms can all benefit from palliative care.
The frontline teams are really great at having those discussions. They talk with families. As most of us know, when there is difficult news that is coming up, sometimes you hear a little bit of the news or parts of the news, or you just need some sort of gentle reinforcement. So we are the second line team that comes in to support the frontline team's assessment. We affirm prognosis, and then we let them know from a risk to benefit standpoint what is happening with treatment, what are the best treatments, what treatments may be more harmful than helpful, and what treatments could be contributing to a good quality of life. So we help them weigh the risk to benefit, and we help them make some very difficult decisions together.
Lab tests and clinical observations can help physicians and families with those decisions. Then palliative care is used to care for patients and families.
We're able to help families and patients understand the situation, and we look at how to make these moments the best moments possible for the patient. And if it's pulling back on some of the aggressive treatments to just honor whatever process is happening, whatever journey is happening, it makes for a better journey for them. We don't have to palliate symptoms caused by very aggressive, harsh measures if they're not appropriate. In a true end-of-life situation, they're walking that walk, and my team and I are walking that walk with them.
That walk with Dr. Estrada turns from clinical to very caring.
I can speak for myself and my team when I say that every time we approach a patient and a family, we approach them as if they're our own family.
In a hospital where we are so proud of saving lives, it's equally honorable to create an appropriate end-of-life experience for our patients and their families.
We figure out what they would want, the music, if they would want to be clean and fresh, or what blankets they'd want around in their pictures. And then we do everything we can to make sure they're very comfortable, to make sure that families around and very close, no matter what we're doing, even if we're removing a patient off ventilatory support, we bring everyone close in there, and we make sure they're holding their hand and they're with them, and then we take a step back.
Those are important and sensitive moments for our families.
I've always been very proud of my job and the job our team does. It's quite incredible, although death and dying can be devastating, as I mentioned. It's happening. It's something we can't control. One is being called to a higher power, to a higher place, and there's nothing any of us can really do about stopping that process. I mean, we try to sometimes, but there is also a way of honoring that process, so it's a change in thinking. It's a change in culture.
That change in thinking, when everything possible has been done from a curative standpoint, honors the process of life and death.
When you think about it, one is going on a certain journey, may it be a very difficult, burdensome journey with a serious illness or an end-of-life journey, the journey's happening. They can walk this walk with us or walk it without us. And luckily at UMC, they have the option to walk it with us. And if we do our jobs well, and we work so hard to do that, under our watch they will not suffer. So because we can alleviate suffering and enhance one's quality of life, no matter what the situation is, it makes it the best job in the world.
When we come back, we'll take you to UMC's newest primary care location, where you can have your own personal physician. That's coming up on the other side of this break.
There's no time for downtime. Better get better, quick. UMC Quick Care has 8 locations, and you never need an appointment. So get in and get better. UMC Quick Care.
Find a dock in my neighborhood.
The nearest dock is the Port of Long Beach, 284 miles away.
Find a dock. Dock!
Calling Doug.
Finding a family doctor in your neighborhood is as easy as visiting a UMC Primary Care. Locations valley-wide, there's one near you.
Find nearest Thai food.
Typhoons occur in the North Pacific Ocean.
There's no time for downtime. Better get better, quick. UMC Quick Care has 8 locations, and you never need an appointment. So get in and get better. UMC Quick Care.
Welcome back to UMC Digest. We're glad you're with us. UMC offers the full range of health care for your family, from our quick care locations where you can get in, get out, and get better quick, to our main hospital and primary care, your own personalized physician to take care of you even when you're feeling well.
Hi, Kim. Hi, good afternoon.
Dr. Tan has been Kim's primary care physician for 5 years.
So is it here? Right here.
Primary care physicians serve as the overall director for your health.
The primary care is the one who would treat the patient as a person rather than a disease.
And preventative maintenance, just like you do with your car, is key to your overall function and health.
Let's give an example about the 50 years old and above. So everybody, as in everybody, when they reach 50 years of age, needs colonoscopy. All female, when they reach the age of 40, they should have a screening mammogram.
Blood pressure screenings and cholesterol checks can help catch the signs of cardiovascular disease before it's too late.
They are making a gamble in their health. That's certainly. If you are not seeing your primary care, then you are missing the benefits of a health screening.
Sharing your medical history, having up-to-date screenings, and yearly visits with your primary care physician helps build a meaningful partnership in your overall well-being.
Patients can feel when they can trust their provider. Their demeanor, the way they interact with you. When you say things to your provider and then they pull through with their promises that I'm going to do this for you, I'm going to help you get to your goal in terms of your health. When everything gets fulfilled, I think that's how you build that bond.
A bond that has helped keep Kim healthy for years.
Dr. Tan always sits with you, always, make sure that before
offering